The Center for Vaccine Development is really on the forefront of almost every vaccine that you can imagine. We have people focusing on all aspects of diseases known to man. We've really been part of almost every major outbreak or disease that have affected the world. Of course, most recently is COVID. The University of Maryland was really in the thick of vaccine development for the COVID-19 vaccines. We did the very first vaccine through our clinical trials here at the University of Maryland. It felt like this was our mission. We knew what we had to do, and it was kind of our moment. I think that people come to the Center for Vaccine Development and Global Health because of the quality of research and because of just the historical experience that the CVD has brought to vaccine development. Our center has had a major role in public health outcomes throughout the United States, but also the world.
The CVD has been around for just about 50 years. And because of that, people are looking back at what the impact of vaccines have been. I think many people know that the impact has been great, but just how great? The estimate is 124 million lives in 50 years. So it's just a phenomenal amount of public health that's occurred in 50 years. So the center, the university, the system has been a big part of that. During the COVID pandemic, because we were a center that has done so many vaccine studies before, we then became a part of actually testing the vaccines in children. We were also in the hospital taking care of patients with COVID. And we were in the intensive care unit with kids on ventilators and kids on heart-lung machines and kids dying from COVID. We're working on a vaccine to try to prevent it, and at the same time, we're in the hospital caring for these sick kids. That was a difficult time, I think, for the people in my world. As part of participation in our trial, we asked the children who are in the trial to draw for us what life would be like when COVID was over. So they just started drawing. And they drew pictures about the normal activities of life that back then were not normal to them. And I think that was a big part of why they and their families wanted them to be in the study, was not only to protect them, hopefully, against COVID, but to contribute to society, to say that will help for everybody then to get back to normal. It's because of their participation in the study that we all had the opportunity to be protected. And that's what we do here at the Center for Vaccine Development.